Hello, and welcome to the second video in the Health Plan of San Mateo's Provider Onboarding Series. So, you're new to the HPSM family and want to get off on the right foot. You've come to the right place. In this video, we'll give you 7 easy tasks to set you up for success at HPSM. To join HPSM, a provider must sign a services agreement and complete HPSM's credentialing process. HPSM's credentialing standards are based on federal and California state requirements, which include but are not limited to the Department of Healthcare Services, the California Department of Managed Healthcare, and the National Committee for Quality Assurance. Providers are required to maintain active credentials with HPSM and will be required to go through the re-credentialing process at least every 3 years. If you're watching this video, you successfully made it through all those steps. So what now? Here are the first 7 things you should do to get set up at HPSM. Step 1. Sign up for our provider portals. Signing up for our provider portals is easy, but what do they do? First, go to hpsm.org/provider/portal. On this page, you'll be able to create an account or log on to an existing account. Our provider portals allow you to verify members' eligibility, submit claims, check claims payment status, download value-based payment program reports, update your information, and much more. This page has information on what each of our portals do, so if you get a little confused, just read the descriptions. Signing up for our provider portals is key to success at HPSM, so make sure it's one of the first things that you do. Step 2. Make sure your provider data is correct. It's critical the HPSM Provider Services Department has the best contact information for you for many reasons. Ensuring your provider data is correct helps us keep our provider directory up to date, helps us connect members to care, allows us to send you timely invitations and updates, and much more. Keeping your provider information up to date is easy. First, visit providers.hpsm.org/change-request-provider. Entering your MPI number auto-populates the form with your information. Update any fields that are incorrect or that you would like to update. Please make sure we have your correct email, fax, and mailing address. For communications purposes, feel free to add additional email addresses or fax phone numbers so that we can reach you or someone in your office. Step 3. Set up electronic payment. Setting up electronic payment is fast, it's easy, and it's free. Electronic payments are also more secure and more accurate than paper checks. To get signed up, first log on to the provider portal at hpsm.org/provider-portal-login. On this page, you can sign up for EFTs or ERAs. EFTs are electronic fund transfers and send claims payments directly to your bank account. An ERA is an electronic remittance advice and makes it easier to access and reconcile payment information. Signing up for one or both requires the same form, which you can find on this page. Please complete the form as completely and accurately as possible. Select which service you'd like to sign up for or select both. Make sure to include a voided check or bank letter that confirms the routing and account numbers. If the form is submitted correctly, you will receive an email confirming your request. If it was submitted incorrectly, you will receive a message on how to correct it. Step 4. Familiarize yourself with HPSM's Provider Manual and other website resources. You can find HPSM's Provider Manual on our website at hpsm.org/provider/resources/manual. The Provider Manual offers everything you need to know about provider policies and procedures while at HPSM. Want to know what to do if a claim denies? Want to know when to file a paper claim over an electric one? This is where you want to look. You can browse the Provider Manual online or you can download it as a PDF. We're also happy to print out and mail you a Provider Manual by request. Step 5. Learn about other ways HPSM providers can receive payments. There are a couple ways HPSM providers can receive additional payments. You can learn about both of them on the HPSM website. The first is through one of HPSM's value-based payment programs. HPSM's value-based payment programs offer performance-based payments to in-network primary care nursing facility and hospital providers for meeting targeted quality measures. For questions on these programs or how to participate in the review process in partnership with HPSM, please contact HPSM Provider Services. The second way you can receive additional payments is through Prop 56. Proposition 56 is the California Healthcare, Research, and Prevention Tobacco Tax Act of 2016 and sets aside funds for services performed to improve the healthcare quality measures in prenatal and postpartum care, early childhood prevention, chronic disease management, behavioral health care, dental services, and more. Medical, behavioral health, and dental providers can all receive additional payments through Prop 56. Please remember that Prop 56 payments are made on a different schedule than normal billed payments. This schedule varies by provider type. You can stay updated on eligible services and Prop 56 payments by visiting the website listed. Step 6. Additional resources. Whether you're a dental provider, a behavioral health provider, or a primary care provider who wants to learn more about HPSM programs for members, we have a ton of resources for you. Visit hpsm.org to check out resources by provider type. You can also review past provider notifications and newsletters for updates that may be relevant to you depending on your specialty. Step 7. Learn about other ways you can help our members. The California Advancing and Innovating Medi-Cal program, also known as CalAIM, is a long-term commitment to address the health disparities and improve outcomes for members by transforming Medi-Cal to be more comprehensive, people-centered, and coordinated. CalAIM initiatives are extensive but include community supports like medically tailored meals, transportation and housing support, population health management through health risk and health-related social needs assessments, and the expansion of dental benefits. We'll talk more in a later video about how to connect your member to services for which they're eligible. Learn more about CalAIM at hpsm.org/provider/calaim-at-HPSM. Completing steps 1 through 7 will help you be set up for success at HPSM. You can review additional tutorial videos at our Provider Learning Lab at hpsm.org/provider. You can also request a personalized training by emailing psinquiries@hpsm.org. Thank you for watching, and please stay on to watch our next video on authorizations.